I am Dr Maslinor Ismail. Now is the part 2 for indices and statistics used in family health. Okay, when we talk about indicators, remember I have introduced to you the definition of health indicators. Okay, and I also have taught you about there are 3 basic sources, we can say, of how health indicators can be made. Okay, first from the scientific evidence or scientific study where you use models, okay, that models in that scientific study to get the indicators. Second, by evolving time, like mortality and mortality or morbidity. Okay, and the third is when you have certain tragedy or certain diseases. Okay, so you use indicators. You take indicators from there. We are going to see what are the relationship between health indicators and social indicators. So before that, we would like to tell you that you have to know that health indicators is a tool to show how broad is the determinants of health involved in certain disease. So it will put emphasis on physical environment, social environment, and health behaviors, including the medical care and medical access that the population can get. And at the same time, we have to understand that life course put emphasis on condition or experience early in life. So sometimes we have to use this type of indicators, okay, health indicators in family health. And when we talk about health indicators, as I mentioned earlier, we cannot run away from relates it to social indicators. But before you understand what is social indicators, you have to understand social determinants, which put emphasis on educational, economic, and social conditions, and those interactive in one population. Okay, so how do we use these 2 health indicators and social indicators? Okay, first, because it's a powerful tools, it cannot stand alone. So these health indicators and social indicators have to reflect each other, okay, and communicate, and we have to adjust if needed in order to get the best, okay, quality of health in one population. And those indicators, we must ensure that those indicators can support and the planning, the developing the priorities when we want to do program, okay, and we want to make sure that we have enough resources, okay, in order to do certain programs and getting the indicators all the time so that we can evaluate the programs, okay. And if possible, we will try to do collaboration and engagement of other partners, or we can say stakeholders, okay, like in Ministry of Health. We can also work together with Ministry of Education. They can also work with other NGOs, like NGOs that is involved in AIDS, involved in family planning and all that, okay. And at the end of the day, we have to make sure that we inform policy and policymakers, and this is to ensure accountability, okay, among governmental and non-governmental agencies. Okay, so how do we compile health indicators? First, we use reports. Okay, depends at every jurisdiction level, they have sometimes certain years, or every 6 months, or every 3 years. Okay, so it depends on the importance of it. And for Ministry of Health, they have state level, they have district level, they have national level. Okay, and every health departments, they have certain units that will take certain indicators into their account. Okay, and at national level, there are more of ensure all the policies are well done and practiced, and they are keeping only the importance indicators only, so that later when they want to use it for private partnership with other countries, okay, other government, it will be very easier. And we can also get data or indicators from international organizations such as WHO, World Health Organization. Okay, and most of health indicators in family health are life expectancy, and most are related to the birth and death. So we also take premature mortality, okay, years of potential life lost. We also take age-specific death rates in infants and adolescent teens. We also take indicators that is cause-specific death, like maybe lung cancer or pneumonia or cervical cancer. Okay, and we have also indicators of how many or how much the rate of the teenagers' pregnancy. Okay, and we have very low or low birth weight indicators. Okay, and we also have adequacy of prenatal care, whether we have enough prenatal care to certain population, and we also look at the social characteristics of parents. That means we want to see what are the maternal educational attainment that they have. Okay, so these are very robust actually, these indicators for any country, because it will imply or it will reflect the health of that country actually. Okay, and whether the health system are accessible to all the population or not. Okay, so when we talk about common health indicators in family health, I would like to give example for mobility or health status under the health-related quality of life. We used to see how many poor health days they have, and they can self-rated their health status. Okay, and we look also under obesity, where we look at the body mass index (BMI). Is either they have measure before it, and they will be measured on spot when we have examination. Okay, and we will also deal with indicators for asthma, for diabetic, and other chronic diseases, for hypertension. Okay, okay, and under health behaviors, usually we look at whether you are smoking or non-smoker. Okay, and we look also how regular you do physical activity, how regular, how long. Okay, and do you maintain the physical activity? Okay, and under health behaviors also, we look at the diet and nutrition. And last but not least, we look at whether they take alcohol, consume alcohol, and whether they use drugs like ecstasy, and other stimulants drugs. Okay, so under access to healthcare, this is more towards becoming a developed countries. Once we want to become a developed countries, we have to have a very good access to healthcare. So it is advisable that any country who wanted to be under the list of a developed country to have insurance coverage for the population, and they should have regular source of care, and try to avoid as much as we can hospitalization, where we can treat only at clinic or specialist clinic, and the preventive services must be ahead more than the curative services. Okay. So what are the examples of data or study done using population-based study that are most commonly done under family health division? Okay, let us look. The first one usually is household population and housing characteristic. So we look at house because you cannot run away from your living condition usually will influence your health. And second thing, you can have study like characteristic of survey respondents. You look at what do they, the characteristic of survey. Let's say they are in rural areas. What are their job spec? And are they schooling up to what level? Okay, are they smoker? Okay, what is their diet like? Something like that. Okay, and the third thing, the third study, fertility and fertility preference. So you look at how many children they have during their reproductive period, and what is the gap between one pregnancy to one pregnancy, and how many infant death or mortality of their child death they have. Okay, and for family planning, we see what is the usage of family planning? Is it to curb from having many children, or to plan the interval between the pregnancies? That is very important. If we are in developed countries, we should be using family planning to control the interval, not to control when there's so many and then only you use family planning. Okay, and you can also do other proximate determinants of fertility. Maybe you want to see whether their job spec have a relationship with infertility, or you want to see stress have relationship to the women in view of getting difficulty in getting pregnant. Okay, so that's another study. And infant and child mortality have been very crucial, where there are many studies about infant and child mortality, because we have to understand that infant mortality is the science that whether there is a good level of health in a country. Okay, so maternal health, child health, and nutrition anemia, those are also other important sectors where you do survey or research. And then last but not least is about HIV/AIDS related, HIV prevalence. Okay, and as I mentioned earlier, we also have now going into domestic violence. We have increasing number of those cases, and as a result of that, we have to look at women's empowerment in one population. There are a lot of mortality rate and morbidity rate or fatality rate that we can study under family health unit, and amongst neonatal mortality rate, infant mortality rate. Okay, so you have all the list there. Okay, so you can look at it and choose whatever related to your study or your area of interest. Okay, lastly, okay, for the second part, you have to look at data sources for common indicators. Okay, as I mentioned earlier, when we look at the who actually compile it, remember we have a certain department like for national level, we have also reports taken by certain hospital or certain department in, let's say, university. Okay, we also have reports compiled by international people, by WHO and all that. So data sources for common indicators also, we have about the same. Okay, we can use national vital statistic. Okay, all the countries have it. Okay, the birth, the mortality. Okay, and usually there are certain disease surveillance system in any country. Okay, according to the disease that is more common in that country, and if we want to go more towards being developed countries, you have to have Medicare or health services administrative data, like Medicare, Medicaid claims, about the billing, about the how they manage the healthcare of that population. Is it under insurance or under prepaid, or they have certain other ways, okay, to actually out of pocket, okay, to actually funding their health. Okay, now we will give you a bit more in depth about social indicators. Okay, before this, I have talked about health indicators. So under social indicators, we have physical environment. So under this physical environment, we have area-based measures where we measure or we take indicators relating income. So we want to know whether they are under poverty group, they are under normal, okay, normal group, normal population, or whether the density of that population is high there over that area. And we want to see the access to the public transportation, about the housing type, and we also look at the physical environment about the environmental pollution, okay, about the air, water quality, okay. And under social indicators, we have social environment where we have individual income. We look at individual income, not the state or district, okay, level. And we also look at education, okay, whether they have high school graduate rates, the students reading, how they can read or not, okay, they can do good maths or not, okay. And how about the social support and connectedness between parents, children, and also teachers, okay. And under social indicators also, we have child and family focus, where we can talk about parental educational attainment, parent practices like breastfeeding, okay, regular meal, regular bedtimes, and access to service such as early developmental screening, okay, for children, and also for family social environment where you can alleviate stress, okay, you can alleviate depression, or you can refer when they have parent stress or depression, okay. Okay, so that is roughly about the second topic where I have explained in depth regarding health indicators and social indicators. If you actually look back, you cannot run from it to be, they have overlapping of each other, okay, in somehow, okay. The health indicators and social indicators cannot work alone. They have to work together in order to maintain health, to upgrade our population health, and to reduce the health inequalities in the population.